Hello, everyone. This is Jennifer Salazar with the Houston Better Business Bureau Education Foundation. Thank you all so much for joining us today. If you keep up with the Houston BBB Education Foundation Scams of the Week, you may already know that the month of October will be devoted to information on Medicare Open Enrollment Period and the Medicare Open Enrollment Period scams. With that being said, the BBB Education Foundation of Houston Scam of the Week for October 19th, 2020 is Medicare Open Enrollment Scams Part 2. And as we've been saying in each week in October, be ready for Medicare Open Enrollment October 15th through December 7th, because my friends, this is prime time for Medicare fraud. If you decide to enroll in a Medicare prescription drug program or Medicare Advantage plan and you meet with an agent or broker, it's very important to know that they have to follow a set rules from Centers for Medicare and Medicaid Services. So let's review the rules. The following information is provided by Medicare Messenger, September 2020. These are prohibited statements and activities. The rules specify that Medicare Advantage and Medicare Part D plans may not do the following. They cannot claim that CMS, which is Centers for Medicare and Medicaid Services, Medicare, or the Department of Health and Human Services endorse or recommend them. They may not use the term free to describe a $0 premium or reductions in deductibles or cost sharing. They may not use Medicare beneficiaries to endorse or promote a Medicare Advantage or Medicare Part D plan who were not enrolled in the plan at the time the plan created the endorsement or testimonial. Let's continue our list. Medicare Advantage plans and Medicare Part D plans are not allowed to offer health screenings or other activities that may be perceived as are used for cherry picking. And cherry picking basically means trying to weed out individuals that may not be as healthy as others. That way it won't cost the health plan as much at the end of the day. That is not allowed. Also, they cannot require attendees to provide contact information as a prerequisite for attending a marketing event. They cannot use door-to-door solicitations, including leaving information such as a leaflet or flyer at a residence. And they are not allowed to approach potential enrollees in common areas such as parking lots, hallways, lobbies, sidewalks, and etc. Let's review what Medicare Advantage and Medicare Part D plans are not allowed to do when it comes to making telephone calls. They are not allowed to do unsolicited calls about other business as a means of generating leads for Medicare plans, like bait and switch strategies. For example, if you have a life insurance policy with a plan and an agent calls you to talk about their Medicare plans, they cannot do that. Also, they cannot call based on referrals, and they cannot call to market products or plans to former enrollees who have disenrolled or to current enrollees who are in the process of voluntary disenrolling. Also, they're not allowed to call beneficiaries who attends a sales event unless the beneficiary gives permission at the event to follow up. There must be a documentation of permission to be contacted. And they cannot call you to make sure you receive their information in the mail. A lot of plans are allowed to send you anything in the mail. That is legal, but they cannot call you to ask if you've received it. Also, this is other things that they're not allowed to do. They are not allowed to ask you for your Social Security number, your bank account number, or your credit card information unless it's needed to verify membership, determine enrollment eligibilities, or process an enrollment request. If you meet with a Medicare Advantage plan or a Medicare Part D plan, do not provide them any of this information in the beginning. Wait until you do decide to enroll in the plan to provide that. Also, they cannot charge you a fee to process your enrollment into the plan. Let's discuss what is allowed by Medicare Advantage and Medicare Part D plans. First off, they may offer a gift of $15 or less, or $75 in total per person annually. And the gift could be provided to you if you want to enroll in a plan or if you don't want to enroll in a plan. It's meant for anyone and everyone, especially at marketing events. Also, they may allow information about their rewards and incentives in their marketing materials. They may provide light refreshments and snacks, but not meals at marketing and sales events. And they may make unsolicited direct contact with potential enrollees using conventional mail and other print media. For example, they may mail you things in the mail. That is fine. All plans are allowed to do that. They may not call you to say, hey, did you get the flyer? No, they can't do that, but they can mail you stuff. And they are allowed to email you. But if they do email you, they have to give you the option to unsubscribe. How do we stop fraud during open enrollment? We're going to review this over and over and over again. We reviewed it last week. We're going to review it this week. Please know that Medicare will never come to your house and they'll never call you over the phone. Medicare will only send you information through the United States Postal Service. Guard your Medicare card and number like a credit card because it's worth so much more. And please never give out your Medicare number except to your doctor or your other Medicare providers. Also, don't let someone push you into making a fast decision. Medicare Part D open enrollment is 6 weeks, my friends, October 15th through December 7th. If you receive a call, especially from a number you don't know, hang up immediately. And know your health care options. Get help from your family, the Medicare website, or your local SHIP, the State Health Assistance Program. And again, and we always say this over and over and over again because it's so important. Medicare will never call you. You'll get a call from the Queen of England because it's not going to happen. Protect your Medicare information. Detect, review your Medicare summary notices, your Medicare explanation of benefits for those on Medicare Advantage plans, and report. If you think something's not right, like fraud, errors, or abuse, call us at 1-888-341-6187. Thank you all so much for joining me for another week. This is Jennifer Salazar with the Houston Better Business Bureau Education Foundation. I'm also the program director of the great Texas Senior Medicare Patrol, where we cover all 254 counties in the great state of Texas. If you need to reach me directly, my direct number is 713-341-6184, or you can email me directly at jsalazar@bbbhou.org. Thank you and have a great week.